I do want to share, first of all, they have their APAC symposium coming up in November. If you were part of last week's Open Studies community call, they had 4 of the studies they presented. That has been a big aspect of what our Asia Pacific community work group has been doing. Also training sessions, hosting the APAC symposium, quarterly newsletters. They have the bi-weekly call on Thursdays or Wednesday nights in the Western Hemisphere as well. So they've really been doing some incredible stuff, and it's been great to see all of the work that they've been doing. We'll have I think we're going to have a specifically APAC focused community call in August as well. So look forward to that. All right, Anthony Senna, you want to talk about what is happening around Atlas?
Yeah, sure. So hello, everybody. The Atlas Working Group is focused on documentation. So if you take one thing away from the 90 seconds that I'm going to talk, it's going to be on documentation. So we have 2 key objectives. First is to improve the deployment of the Atlas and Web API tools. So to do that, we are looking to improve the documentation, which outlines the steps by which you would deploy the tools. And as a working group, we've been kind of talking through those steps and trying to identify opportunities to improve the deployment process. So for example, where we have a series of steps that you have to click through, could these steps be scripted and create an automated script to do that? Our second key objective is more on the code documentation side. So the Web API platform that powers Atlas is lacking a lot of descriptions for the REST endpoints that we use. So our key results for this quarter are to document 100% of those endpoints and make that Web API docs link that's in the slide here available to the community in a more prominent location, specifically on the README page of our GitHub repo. So to that end, we've started some work to document the endpoints. Specifically, I want to give a shout out to Adam Black, who's been pushing hard to make that happen, and others in the working group that are contributing to that branch of work. So that's what's going on, and our next meeting is tomorrow at 9 a.m. So come join us if you want to help with documentation. We'd appreciate it.
Great, Anthony, thank you so much. Next, we move on to the CDM work group. Claire.
Okay, so we have hosted 6 different workshops so far this year, 2 of which were on the global community call. So thank you all for being willing or maybe unwilling participants, but it's been great. And I think they've been well received, and we're going to continue to focus on those. We started to think about CDM extensions, and we realized that we don't have a great process for defining how suggestions and needs from the community actually become part of the canonical CDM. So we wanted to work on that prior to thinking about extensions, or I lovingly call them, I think about them as like fan fiction, like it's great, but maybe doesn't need to be part of the canon, but still super useful and super interesting, like Emmanuel's paper that they just wrote about microbiology. So we are going to be focusing on extensions once we get done with the canon proposal process. And then we haven't quite started on the resource library yet, but that will be focused on once we finish the key result too.
Great, thank you, Claire. Do you want to also hit on the vocab subgroup, or I don't think Kristen
I think
is.
Mick might be better for that.
I don't know if he is on.
Okay.
Oh yeah. Okay.
All right. So I have technical issues. Can you hear me?
I can, yes.
Okay, good. All right. All right. So yeah, the rolling process. Want to collect requirements from the work group and organize a recurring workshop. Haven't been doing that in the first quarter, but plan this for the next one. We're on the way of publishing instructions for the community so that they know how they can contribute in selection and prioritization, as well as adding new vocabularies. And we're currently working on this by working on the new race and ethnicity vocabulary, which would be number 3. Okay.
And then we have a second slide. We we can leave this up here, but you can talk about increasing transparency and documentation.
Right. So we do publish a vocabulary roadmap now on quarterly refreshes on GitHub. So you can look it up in the GitHub wiki of the vocabularies. And we are in the process of creating GitHub pages for documentation, similar to what the CDM workgroup has. We have established GitHub discussions, but we haven't been really using them a lot, so we need to promote this feature a bit more.
Great, Mick, thank you. Our OHDSI China chapter, I thought this one might be a bit of a long shot, but is anybody on from the OHDSI China chapter? All right, I'm just going to scroll through. They have their objectives here, and you'll notice on objective 2 is clinical studies. This second slide will highlight the 4 clinical studies that the China chapter has proposed for 2022. All right, we'll go back to Claire now for data quality.
Okay, so we have been working really hard in the data quality working group. We are really trying to focus on our contribution to the evidence generation system Patrick has talked about earlier in the year. But to do that, I like to think of it, we need to get our house in order. So we've been focusing on issues and pull requests on the DQD GitHub. I want to thank everybody who has actually jumped in, especially from the open source call that Paul held. That was great because I got a lot of new folks interested. So that has been fantastic. And then also I want to shout out to Dimitri and Luis from Odysseus. They've been working very hard and they have really done a great job adding new features to DQD and updating the documentation. So once we get that finished out, we're then going to focus on key result 1, which is, I think, more of a thought exercise, but we're really excited to dive into it.
Excellent. Thank you, Claire. Early stage researchers, Faiza, I know you're on. I'm not sure if you and Ross, we have 2 slides, so I have all 4 of your objectives. So when you move past objective 2, I'll go to the next slide.
Okay, yeah, I don't know if he's here, but I'm happy to speak about the working group. So we have a few different objectives. One of them is to perform research within the working group. So we are trying to have a network study that's designed, led, and performed by the working group. And we also want to increase the number of regular participants. I think this has been challenging, but having attended the leadership summit, I think, has been helpful to give some ideas as to how to improve membership. Other objectives include just increasing early stage researcher member presence at other OHDSI meetings. So one of our key results for that is to have at least 10 presentations at other work groups given by our members, just to increase their presence and involvement in the OHDSI community. And then finally, we really want to provide career development opportunities to members. So some ways that we want to do that are to have at least 5 presentations at the OHDSI Symposium from some of our members, as well as organizing tutorials, which have been successful in the past. We had one on cohort building that was really popular. And then finally, to hold a career event through OHDSI, and this will probably be through the European team.
Thank you, Faiza. Let's move on to education. Nigel?
Hello. Hi, Craig. Can you hear me?
Yes, I can.
Okay, no camera, so I'm having some technical difficulties. So thank you for the education work group on behalf of our group. It's a mixture of understanding what we're doing from an educational point of view within the OHDSI community, leading also to where we want to be in terms of education across the OHDSI community, which is obviously vast and diverse and growing quite rapidly. Importantly, I think triaging and signposting to what educational resources we have within the OHDSI community, and mapping that and providing resources for the future is critically important. Certainly also linking that to what we're calling learning pathways. So working from people who newly join the OHDSI community as kind of novices, but then going up the learning curve in terms of, more intermediate through to more expert and to more kind of ultimately mentor kind of level that some people have already, is kind of important. But we need to support the individuals in those different roles within the community overall. And also to develop a number of resources that we want to support the community in terms of that signposting and triaging, how do I, what do I, those kind of guides, as it were. And ultimately, actually, what's really important, and for those attending the OHDSI Symposium later in June, so in about a month's time in Rotterdam, and also in October, the global one later, will be some opportunity to talk to members of the Education Working Group. But we're looking for more members too, and particularly kind of sub-teams, which can work on developing some great educational materials to support the community at large in terms of, if you want to know more, understand more, and be engaged, whether it's theoretically or hands-on within the OHDSI community educationally, and improve what you do in your current practice using the tools, skills, and methods that are developed within the OHDSI community, then we want to develop those resources for everyone to be able to use and to work with and communicate on. But then we need some support in doing that as well from across the community. So a quick update on what we're doing, but also a request if anyone's interested to join us or involved in developing some further work around this that will serve the needs of the community, please do let me know, or indeed come to some of the meetings at the OHDSI community meetings in June and October. Thank you.
Thank you, Nigel. I didn't mention this, but if you're confused on the one we talked about, mentioned in June, that is the OHDSI European Symposium that is in Rotterdam in the Netherlands. So the European Symposium, end of June. We're going to hear about that at the final community call in June, and then obviously the Global Symposium, which will be in October. And we had a great update on the eye care and vision research work group a few weeks ago, but if Sally or Kerry, I believe Kerry was on, if anyone, I have 2 slides for your 2 objectives if you want to highlight these.
Hi, this is Kerry. Sally's in clinic today. So we are, again, as Craig said, a brand new group. So we're just trying to get things off the ground. So our first objective is to raise awareness and get folks in the ocular health and vision research community to understand OMOP and the importance of standardization and being able to do some of the research that OHDSI is used to doing. So we have established a meeting schedule as of this morning. So we'll be announcing that to the groups shortly as soon as we get the confirmations in. And then we created a tip sheet on how to find information and have shared this with the community at several large conferences. So next slide. So the next thing we want to do once we start meeting is actually just figuring out like how much eye relevant and vision research information is already in some of the OMOP tables. And we'll be looking at 2 providers, Epic and Cerner, to see how much of their elements can map to OMOP concepts, and just identify some gaps in other research data dictionaries, such as the American Academy of Ophthalmology's IRIS Registry and the All of Us Research Program database. And that's all I have for right now.
Great, Kerry. Thank you very much. And we'll make sure to announce to the broader community the meeting schedule as well, for anybody who wants to join in this work. All right, our FHIR and OMOP work group, which there are a number of subgroups that we wanted to list on this page. I don't know if Dana is here. I don't think she can make these calls typically. Is there anybody that wants to share? I have 3 slides, I believe. Yeah, 3 slides. So maybe I just want to talk about kind of what's going on. I'm going to share the 2 slides here. If not, I will just post these slides so you can see. We'll certainly hear more about FHIR and OMOP moving forward.
I'll just highlight also, Craig, as it relates to FHIR and OMOP, that there's several important work group activities that will take place at the OHDSI Symposium. So for those who are looking to sign up for the OHDSI Symposium, the main conference, the tutorials, but also the work group activities, the FHIR-OMOP work group has set up a series of activities focused on specific targeted collaborations that folks should take a look at and sign up for if they're interested.
I could say a little bit also about it. There's three kinds of activities that are going to be initiated mostly around the Connect-a-thon that's in point 2 there, that's coming up very soon. And that involves scanning all of the work that's been done throughout the OHDSI community on FHIR to OMOP mappings, figuring out which ones that are related to the U.S. core can develop model ETL code that can be tested, and develop a validation strategy for testing those and making all of that shareable. I think the first set of meetings and activities is going to be more around scanning those and just defining some initial use cases, probably around quality care, and that'll develop over the course of subsequent Connect-a-thons. And I think maybe there's 2 or 3 more of those happening between now and the fall.
Okay, thank you, Andrew. You can just keep yourself unmuted if you'd like, because we're going to go to the GIS, Geographic Information Systems work group. I didn't see Robert on, so Andrew, do you want to just make a couple comments as I'll share the overall objective and key results slide?
And sorry, this is more wordy than it ought to be, but the GIS work group is in an exciting position after years of work to this very broad set of goals around enabling place-related data to be linked to where people have lived. And in order to do analyses that say, if you've lived in a place that has this attribute, your social determinants of health associated with that place where you lived, or an environmental toxin associated with that place where you lived, can be related to health outcomes. And some really excellent work has been done to prototype code that uses a stateless method for getting source data, publicly available source data about geographic regions, and staging it so that it can be analyzed in relation to OMOP clinical data. And the initial use case that is being worked on for that is the Social Vulnerability Index. And please come both with your use cases of how you might take advantage of any kind of publicly available geographic data, or with your development expertise to help contribute to that work of kicking the tires on this initial code. That's in general. We're going to go at doing that better than walking through that.
Right. No, absolutely.
Overly verbose list there.
And just for anybody who, we're going fast through these slides, all of these slides will be posted to the community calls page. So you can really go through and read all of the objectives and key results for all our full work group community. All right, Martine sent me a message this morning that he will not be able to make it. This is one slide. I don't know if anybody from the Hades team wants to comment on it, but you can see the objective and key results. And we have more coming from our open source community, since we actually have an open source community work group. Patrick, do you want to?
Hey, I'll just highlight that I think the Hades group is making good progress towards this idea of trying to standardize different modules associated with how we can put all of our open source tools together. And so the group's been making good progress on trying to formalize package development, defining the inputs and outputs, and trying to make those become more cohesive as a solution. So I think much of the next quarter will be continue to be focused on this modularization and increased standardization of our tools to mature how we can use them all together towards a cohesive evidence system.
Great, thank you. Healthcare systems, Melanie?
Hey, good morning. So this first objective here, the first and second points, we are getting through this very quickly. Number 3 is I'm going to be putting out a survey here sometime this week. We're just trying to create a central repository of different OMOP sites with EHR source data. So that way we can hopefully build a type of mentoring network, or at least places where people can go and find others, you know, doing the same type of research or in the same part of their journey, technical requirements, same source data, things like that. So people will see that. I'll put it out onto the forums, and I'll have Craig introduce it, put the link in next week during the community call. The next slide.
Wait, which one?
Whoops,
Sorry,
sorry.
2? Yep, sorry.
There we go. Yeah. So we are not getting very far with this, but one new thing I would like to say is we have a new collaboration between the Oncology Workgroup and the Healthcare Systems Workgroup. Oncology wants to help us incorporate EHR data into the oncology extension, create a reference implementation, get and give feedback on use cases, challenges, and solutions. The combination of registry data and EHR data will provide, especially in oncology, will provide a much fuller picture of a patient's journey. So that's a brand new collaboration. I'm going to put more information out about that on the forums. And then the next slide is we have had some really good presentations so far this year. We started off the year with InterSystems Health, and they talked to us about how they have on their roadmap, they want to build an OMOP adapter off of Epic Chronicles or Clarity. So that was really interesting. You can find the link to that recording in our files section along with the slides. And then we had another interesting presentation and discussion on exporting data out of the CDM for further analysis or discovery based around tables or fields or PHI or other items not supported by Atlas. And that presentation is also in our file section of the healthcare systems page on the MS Teams.
Thank you, Melanie. Health equity, I know Jake is not able to make it. I have
I'll take it. Jake
okay, great.
emailed me last night. So we have a lot of long-term OKRs, but after the leadership meeting last 2 weeks ago, we sort of honed it to be more sort of small bites as opposed to big long-term. So in long-term, we want to generate and disseminate real-world evidence about substantial public health issues of health inequities, operationalize individual level social determinants of health, risk factors, and needs, and other data elements relevant to health equity work in the OHDSI network studies. And under each one of these are sort of like lots of big goals. But so we turn these into 2 reasonable OKRs for the next sort of calendar year. One, the first activity is sort of a collaboration with the N3C folks. And so the social determinants of health and social needs data, we are essentially just doing like understanding what data is stored in EHR and extracted to OMOP. And so we're working together to find people who have social determinants or social needs data in their EHR. So if you are one of those people, please come forward. There are a few group members who are working really hard at collecting this information in their EHRs. And then for mappable data to find, to map the found data to standard concepts and then record anything that's like unmappable. And then the second activity that we have planned is to group together similar concepts to create a high level of buckets of social determinants and social needs data. And so this is things like food insecurity and transportation insecurity, et cetera, and to use the models that are provided by N3C and Gravity to create those buckets. And then ultimately, we'd like to make the groupings easily available to the OHDSI studies that are looking to use them. So maybe creating concept sets or potentially adding vocabulary classifications. So
Great.
Those are our.
Thank you, Brian. I hope you people could kind of scroll through the larger OKRs while listening to you, but that's great to hear those updates. Jose, I have all of your slides. I think this is 6 total slides, so you can just kind of scroll and tell me when to scroll.
So in the center of all the OKRs for the Latin American Working Group, it's to increase the reach, increase participation, and increase collaboration. That's sort of the summary of that. So for that, we've been trying to get more people into the monthly calls, and so far that has been, I believe, a success through now very successful examples of conversions that are happening within Brazil and Chile. So that's been really exciting on those calls. Also, we've been trying to preach the OHDSI gospels as much as we can in different venues. I have been even invited to full Portuguese events that has been a little interesting. I've been speaking in Spanish among the Portuguese audience, so that has been quite interesting. And also our calls are usually on 3 languages, so that has been quite an interesting experience. So the third OKR, right? That we've been a little stagnant of this. We really want the vocabulary to incorporate a lot of sort of a local that are sort of low hanging fruit, because SNOMedicine is in Spanish as well, and I believe there is in a Portuguese version. So we've been trying to. There are some posts here and there and some issues. So we've been just a little standing of this, but we want to work ensuring that we have a Spanish and Portuguese version facilities is NOMED. And this one, we have not worked on this. So Paul, we really need to set up a call. So we sort of join efforts on trying to produce more material. And I already talked about this. So that's the short summary, and this is already happening. So we had a community call of this proposal by the Albert Einstein Hospital, and they are refining so that proposal so we can share it broadly with the community to receive feedback and hopefully to try to run a network study later on a Latin American institution. So that's about it. So if you want to join, you don't need to be from Latin America to join. We really would like your input and your collaboration to make this dream happening. So thank you.
Great, Jose. Thank you. Paul, do you want to, or whoever, medical imaging, I got 4 slides for you.
You can just leave it on this one. This was totally fine.
Okay.
So the imaging working group has been incredibly productive and active. We have had a great participation. We started about 6 months ago, and a lot of that is due to the credit of Chan, who's my co-lead, who's really just a tremendous tour de force. So what we're doing is most health systems have a medical imaging archive, whether it's a PACS system or a vendor-neutral archive. And this group is trying to put together how do we bring important features and facts from those medical images into the OMOP data model. We have brought in a number of really important leaders from the radiology and imaging ontology community, like Charles Kahn and Tariq Al-Qassab, who've done a lot of work in structured reporting. We've brought in the co-chair of the DICOM interoperability standard, and we've made tremendous progress. So we actually feel like we've gotten down the semantics, the vocabulary. We've really been working on the extension. Our plans are to have, by July, we plan to have our data model and our basic model for semantics and structure finished with a use case that we're building around populating it with pulmonary nodule studies. And so this has been very fruitful work. We're hoping to bring to Claire our CDM extension model for medical imaging and then begin working on reference implementations in this fall. So if you go down like 1 slide, I think you'll see our actual OKRs. But we have been making steady progress. We've had great participation from lots of different imaging research groups around the world. And we alternate our calls every 2 weeks from 7 a.m. To 7 p.m. to be able to bring in our European colleagues and our Asian Pacific colleagues as well. It's been really a productive group exercise, and we're excited to see this data model move forward.
Thank you, Paul. Next is NLP. I don't believe Hua is on. So I'm just going to leave this up here if anybody wants to hit on it. Otherwise, we'll move forward. Okay, let's go to oncology. So honestly, I've got a few slides here, structure and then the OKR, so you can kind of move me around.
Thanks, Greg. You can actually move to the other one. Hi, everyone.
Oops,
just oh, maybe the previous one. Just a reminder, I'm going to present OKRs from 3 different subgroups of oncology. So we're divided into 3 different groups, a combination of vocabulary and development, work group, genomic, and outreach and research. So the Vocabulary and Development Workgroup is currently focusing on improving the ETL from NACER to OMOP, very focused on completing the vocabulary for cancer, all the modifiers, and also improving and finalizing the ETL so that we can actually move and to the research side. So as Melanie just introduced, we just announced a collaboration with the Health System Interest Group on the development of the roadmap and developing the oncology extension reference implementation for EHR. Next slide, please, Greg. So within the genomic working group, the biggest focus is on enhancing and validation of the genomic vocabulary. There's a lot of background work that's currently happening on cleaning up and documenting everything that has been done so far. One of the on-ramps is making the ETL impossible from the source data to the genomic vocabulary, and also coming up with best practices in that standardization of genomic and other omics data. And finally, with the research and outreach, we have two big OKRs. The first is the dissemination and adaptation of the oncology module, constantly working on the documentation of the work group, adapting the changes and making sure that we can disseminating it, developing training modules, and also working with our data partners and investigators, everyone who's working on adapting the module and bringing them in, helping them with the work. And also, there's several analytic use cases and studies that are ongoing. We're planning to finish this, and also helping with collaborating with the phenotype, the work group on developing reusable oncology phenotype, at least one each month. That's it. Thank you.
Great. Thank you, Asya. Paul, open source, this one slide.
Yeah, the open source community, I have the pleasure to have the co-lead of Adam Black. And our OKRs were to help basically create the open source working group. We have hosted an open source developers conference. We've highlighted several of our projects, and we've actually developed an on-ramp for new developers, our Chiron project. We're really excited to get 24 volunteers as part of our Chiron project. We have a meeting tomorrow at 11. The meetings are a lot of fun. Everyone is welcome to join us as we go through and work on open source engineering exercises within our projects. I also really encourage a lot of our maintainers to start thinking about putting together documentathons and hackathons for our Chirons. We now have a great team, and we're looking for more activities that we can work on as a group. And so we're meeting 2 of our 3 OKRs are right on track. We're still working on the metrics one. That one has been really fun to work on, but had to define which of our projects were core. We've come up with a data model, or came up with a framework for measuring the health of a project, and now we're going to the process of trying to try it out with our data to see how it looks.
Thank you, Paul. PLP and PLE methods. Anybody want to, either Mark or Jenna? No, Martin's not here.
Yeah, I'll happily step up unless Jenna would like to. The patient level prediction, population level estimation work group continues to push forward in methods development for the OHDSI community. Some of our key results so far through 2020 is the establishment of a formal cohort database and study diagnostics, and these will be codified into the additional work that Hades is doing in terms of taking all of our tools and breaking them up into modules to make sure that each of the submodules provides these important diagnostics. We continue our work on designing a discovery system for a large number of pharmacological and other medical devices safety surveillance, and the key idea here is this large-scale discovery system will have desired operating characteristics, so the appropriate false discovery rates, so that when there is a signal, we have some that it's backed up by reliable evidence that it's a safety signal that needs to be followed through even more thoroughly. We're continuing the development of sort of a risk-benefit framework for observational research. Up to this point, The community has been focusing more on signal detection, but there's always a calculus on what are the risks and benefits, and how you incorporate that type of information is very important research. And throughout the end of the year, we'll continue to look at better ways of providing reliable observational evidence from a causal framework using different counterfactuals, and then predicting the counterfactual outcomes for the causal risk models. For those of you that are interested in this type of methodological work, we meet on Thursdays. We're a very open, fun, and dynamic group, so please join us. Thank you.
Thanks, Mark. Let's go to phenotype, either Gautam or Aza.
Hello. Hey, can you hear me?
Yes, I can.
So, yeah, absolutely. Thank you for the opportunity. So, we as a work group, we worked, as you all know, with the Phenotype February was a broad involvement of the community. We used the forums to communicate. We helped develop 30 phenotypes in the community, and more importantly, the work group facilitated the leads of the through using office hours. So we worked with several new OHDSI collaborators for them to develop the phenotypes, and we shared them in the work groups. We've also released an initial framework of using the OHDSI forums and the Atlas tool to serve as the phenotype library. So that's the work that we have done as part of the first quarter. For the future, rest of the year, we are putting together the lessons learned from the Phenotype February as a submission to the OHDSI Symposium. We have discussed the need to create a list of phenotypes that a surveillance system would work on. So like Mark said in the previous discussion, so if a surveillance system has to identify causal relationships, it first needs outcome cohorts. So we are working on that. We have discussed using the combination of probabilistic and rule-based phenotyping based on the work of Juan and Tiffany, and we're going to explore that. We are also working with Joel and Jamie Weaver on measurement errors. So they are building a framework of identifying measurement errors and the impact of those on analyses. So that's the future proposed work of this work group.
Great, Gautam. Thank you so much. Let's move to psychiatry. I apologize. I pulled this over to my slide and the bottom. I thought I had fixed that, but clearly didn't. Anybody from psychiatry want to just highlight this briefly?
Yes. I mean, is Dima you on? I don't think Dima is on.
No.
So we are meeting again after a bit of a hiatus. We wanted to reschedule in order to accommodate people from different parts of the world, because we knew we had lots of excellent use cases, both from Asia and from Europe. But the main goals are listed here, and that is broadly to be supporting a variety of studies that are focused on these content areas of psychiatric, neuropsychological, neurological interventions, and to further the work that's already been done over the last couple of years on developing the OMOP vocabulary for the scales and scale scores that are measuring these things. So there's been a fair amount of surveying of what exists and is of interest to answer particular questions, and strategies for getting data, perhaps through natural language processing or other means that where you don't have structured data on having been given, say, depression inventory scores or other kinds of things, but how to represent those, how to who's got those data, and the use cases for putting them to work are the main things we're working on. There's some sub goals around vocabulary, both getting new vocabulary into some of the standards development organizations that we're working with, and we've got some excellent collaborators from both SNOMED and identifying some from LOINC on that, as well as how to structure those terms in the vocabulary. There's the National Institutes of Mental Health have a framework that grounds behavioral problems in their psychophysiological underpinnings called RDoC that might be use to help organize how concepts are related to one another so that you can search for things that are conceptually related to one another and to a greater degree than you might otherwise. And that's the gist of what we're doing. But we're meeting again tomorrow for the first time in a while. So please do join us. There's a lot of excellent activity, and it'd be great to join you.
Great, thank you, Andrew. Registry, why isn't this moving? There we go. Registry, Tina. I see Tina here. She's unmuted.
Oh, sorry. Yeah, typically of me. Sorry. Registry Workgroup is a fairly new group as well. And I just took over the lead or the co-lead 2 weeks ago, so bear with me. And I realized I forgot some objectives as well. But this year, I want to focus on promoting the use of OMOP for registries, because registries are different from EHR in claims data, obviously. And we want, as a first result, we want to create an overview of use cases in OMOP or want to be OMOP registries. So basically a landscaping of current OMOP registries or to be OMOP registries and their use cases. And we want to create an overview of all the challenges that occur in mapping registry data to the OMOP common data model, also by sharing experiences. And then we want to facilitate the use of OMOP for registries. We want to draft a document with registry conventions or registry mapping conventions that address the challenges of Objective 1. And we want to focus on not only disease-specific registries or mapping conventions, but also on disease-agnostic conventions. So I think we will have some overlap with other work groups as well. And we try to do the first round, review round this year for that document. And of course, we are still new, we are also in the phase of reaching out, raising awareness for the registry work group. And then in the end, we want to facilitate the evidence generation across registries and across OHDSI.
Thank you, Tina, and I appreciate you your leadership starting recently to help out with Maxim. The steering group, Patrick.
Thanks, Greg. So our steering work group is primarily here to enable our community to generate evidence in the scientific work products that are necessary to generate evidence. In the first quarter, we were focused on trying to help work groups define objectives that they could communicate. And so this meeting in part is something that we really were trying to help facilitate so that we could have greater transparency into what's going on. Paul Naji's done a great job convening work group summits so that we can actually share best practices across our work group. And we're also trying to work towards just having a greater transparency by communicating dashboards about what we're actually doing and what's the health of our community. And we'll continue to try to communicate of how work groups can be best practices we think that establish how work groups can be effective amongst themselves, but also trying to make sure that we stimulate greater connections across work groups by providing guidance and best practices. We encourage anybody who'd like to join the steering work group. Really, it's just a place where we're trying to think about the health of the overall OHDSI community and how we can collaborate together more effectively. So encourage anybody who's interested. We have standing meetings on Fridays at 11:30 a.m. Eastern time, and really welcome anybody who'd like to participate to come join us. Thank you.
Hey, thank you, Patrick. I don't believe Evan Minty's here, and this work group hasn't really even formed yet, but I just wanted to go through because it's something that is certainly in conversation. So at least wanted to give you, Evan, are you? I don't believe he's there. Okay, so this one is being formed. And then our last one, Vaccine Vocabulary. I believe this is Adam, who I also don't believe is here. Anybody want to highlight Vaccine Vocabulary? Otherwise, certainly you can read it. All right, so that is a full look at what is going on through the OHDSI community. So one thing we want to make sure you know is that during the actual symposium, there's going to be a chance for everybody to go around and talk to people from these different work groups. So we want to do this, you know, not just once a year, besides the updates, but just to know what is happening, what's going on, so that we can increase awareness and increase collaboration within the work group. So for all the work group leads, thank you for sharing these OKRs, for describing them, for doing it in the time frame that we actually closed right at 12 o'clock, which I was highly doubtful of, and for letting everybody know what's going on. If there's any questions, feel free to use the chat. The slides will be posted later. The video will be posted later. Thank you again to everybody for joining, and please do join us next week for our Welcome to Odyssey call, specifically for newcomers, but everybody's invited. Thanks, everybody. Have a great day.
Thanks.